But this time, nurses constitute about 60% of the workforce, and it's the first time they are going on strike. So now, what are some of the issues why they are on strike? You remember, I think 27th of June, the National Salaries, Incomes and Wages Commission came up with a circular to adjust their allowances and their call duty and their retention allowances, what have you. So, and the nurses have been saying, no, this is not fair, and you cannot adjust at this time where there is economic hardship. You cannot be adjusting their allowances in that manner. And we heard that government, through the National Salaries, Incomes and Wages Commission, in the meeting with the Minister of Finance, had withdrawn that circular. But we do not know how true that is. And with this strike commencing 2 days ago, it shows that actually that circular was not withdrawn.
Okay. Now, how have the nurses' concerns about the staffing ratios, working conditions, and patient care been ignored or dismissed at the moment?
You see, the nurses, or the medical sector, is one of the essential duties services providers, according to the 2004 Nigeria Labour Law Act and law. They are not expected to go on strike. Media people are not expected to go on strike. The security personnel are not expected to go on strike. Well, however, if a hungry man is an angry man, as they say, and they are hungry and they push to the limit according to them. They gave a 15, don't forget they gave a 15-day warning. They say because of patients, we are giving a 21-day increase. Because of patients, they came back and gave 15 days, which expired on the 31st of, on the 30th or thereabout of July. And before they embark on this, they are very much aware that patients are suffering, but they also say they are family members. They have families also that will be going through this. I think the only language they think government understands is strike, and that is why they are going on strike. But aside that, I must tell you that some of the issues they are worried about is that in most states of the Federation, the minimum wage for nurses and midwives have not been implemented. Okay. I spoke with the chairman of the nurses in Katsina State, for example, and he said an abysmal 20,000 naira is given for nurses' uniform allowance. And that is one of the issues they are complaining about. And in comparison with their colleagues, the doctors, is much higher. And they said they don't want equality because they know that doctors are placed high in the medical field. They want equity. And what is equity? If you are giving a doctor 100,000 naira, for example, for uniform allowance, and you know what the doctor wears, he wears that robe. And you're giving a nurse that has to wear a gown and colors, and as mostly women and nurses, 20,000 naira for a year, what do you expect her or him to do with that? So that's some of their grievances. And they also say that 25% consolidated health salary structure has not been implemented in most states. Okay. So those are some of the grievances they have.
Okay, lots of issues there. But now, Abulu, we understand that doctors are also meeting today. What might be the likely outcome of the meeting? Yes,
before I tell you likely outcome, doctors are also complaining about inadequate salary. And they say that is why you have a lot of brain drain. You know the percentage of doctors that have left the country in the last 5 years, running to about 800 or thereabout. And doctors are also saying that there is poor working condition, the same complaint the nurses have. Now, the meeting that is holding today between the Minister of Health, Minister of Labour, and nurses and doctors, for some of us, we expect that first, government withdraws that circular, which they say is obnoxious, and two, government looks at uniform allowance for nurses and look on how to improve the salary of doctors. And those are some of the issues. Basically, the economy is biting on all of us. But the doctors said they are engaged with saving lives. So they cannot be, their salaries cannot be toyed with. When you look at humongous amount given to some persons as a congratulatory gift, and doctors are saying, no, what about us? So I think, for me, our expectation at the meeting is that government should say, okay, fine, your salary will be increased. 2, your uniform allowance will be increased. 3,
or reviewed.
Yeah, reviewed. 3, condition of service. And when you say condition of service, Sajat, what are you talking about? You go to the hospitals, you don't have hand sanitizers for nurses, you don't gloves, even gloves, they buy it themselves to come to the office, and even the theater slippers they wear. Some of them buy it to come to the office themselves. And you begin to ask yourself, what am I working for if I don't have all these things available?
Basics.
And if you look at the ambulance, for example, the ambulance driver, does he have care? Is he being well taken care of? These are some of the items they call condition of service.
Okay.
So, well, I hope the minister is able to address this.
Okay.
But one other concern by labor is the move by government to introduce a policy to stop strike. And some are asking, what kind of policy do you want to introduce to stop strike? Strike is the last resort, and it is allowed in international labor organizations.
I must thank you for joining us on AIT Report.